Well, good afternoon. It's good to come back to this part of the country, having been east now for 8 years, because this is where I learned what public health was all about. It was while I was state health director that I learned about this. I was traveling. Illinois is kind of a big state, for those of you who don't know Illinois. In fact, we used to have meetings in Carbondale, and after we'd have a meeting in Carbondale, they'd say, well, let's have the next meeting in Atlanta because it's closer to us than is Chicago. So this is a big state, and as the governor used to tell me on a frequent basis, the #1 industry in Illinois is agriculture. And I learned that lesson trying to drive to a small local health department, and of course, I knew the way. And I was on this road, and you know how those roads, they start out like a, 2-lane highway, and they're paved, and then they turn into gravel, and then they turn into, 2 tracks in the grass. And it was about that time that I figured I was maybe getting lost. So I was looking for somewhere to try to get some directions. And I saw this little house at the end of this grass-covered little trail between the rows of corn. And I looked at this house, and I didn't see any electrical wires going to this house. And they had a windmill. And the windmill was hooked up to the water well, and they were pulling in water. And they had their own little garden, and they were growing their own foods. And I started walking up the house to get directions. I was a little bit leery, because you never know what kind of crops those kind of folks are growing and how likely they are to want to see visitors. And for you city folks who don't know what I mean, they sometimes grow crops that aren't exactly legal. So I walked up to this guy and I talked to him, and it turns out he had turned on, tuned in, and dropped out in the 70s. It was a fascinating conversation. He homeschooled his kids, he grew all of his food, and I realized I was talking to the only person in Illinois who wasn't using public health services. Because public health services have an impact upon people's lives every day. And you, as researchers in public health systems and services research, play a critical role in creating the evidence base that will enable our public health systems to not only continue into the future, but to grow and to meet the major challenge. So what I'm going to talk about today are to talk about 3 megatrends. 3 things that are going on as trends that will have an impact upon public health agencies, and should be taken into consideration as you're considering topics for public health systems and services research. So I'm going to talk about health reform, because the system of healthcare delivery is in the process of restructuring. This restructuring began before the passage of the Affordable Care Act, and it will continue regardless of what happens in Washington. The second is about the Affordable Care Act itself. And the third, something that I'm sure all too many of you are aware of, the issue of state budget cuts. So why are we facing health reform in this country? And you probably have all seen this slide. The United States is way more expensive for the delivery of health care than any other country in the nation. Excuse me. We know that health expenditures are going up dramatically. We're up to about 17% of the gross domestic product. That has a tremendous impact, but when we project this out, just project this out into the future, we see that we're talking about somewhere in the 2030 that we're going to have a significant increase in our amount of GDP that we're spending on healthcare, up to about 37%, which even for someone who comes from Illinois, that's a large amount. And we're talking about 43% of the federal budget, which is pretty much okay if you're like a health person, but there are other people who think that the federal government ought to be doing things like transportation, education, the military, those kinds of things. And maybe not all of us agree with every one of those, but any way you look at it, this kind of growth is no longer sustainable. But the question is, what do we get with all this money that we're spending? Is it the fact that the Americans are getting healthier? Well, first of all, we know that this money is being spent in ways that are dramatically uneven. And it creates a paradox, as Elliot Fisher says, is how do you explain to someone the fact that the best health care in the world in New York City costs twice as much as the best health care in the world in Minnesota? Tremendous amount of cost differential, which represents waste. How can we give better care in a way that's most cost efficient? And the problem is that, as Elliot Fisher said, is that more care isn't necessarily better care. As you can see from this graph, on the left-hand side are those regions of the country where the cost is the lowest. And you can see that the cost increases as you move from left to right. But if you look at the second bars and the third bar in each pair, which is the mortality rates, and whether or not they're following the guidelines, such as aspirin on discharge after a heart attack, there is no correlation. Those who cost more don't necessarily provide better care. And we know that in the broad population perspective, that our nation, which is all the way at the top when it comes to cost, is just right in the middle of the pack in relationship to life expectancy. And we know that for certain populations in this country, life expectancy is even much significantly lower. We know that life expectancy isn't consistent across the country. We have variabilities from one region of the country to another. And once again, the healthcare system is not meeting the challenge because, as we know, healthcare cannot meet all of the challenges. It requires integration. It requires a comprehensive approach to look at all the various determinants of health. But even though we're spending trillions of dollars on healthcare, individual people are not getting the care that they need. This was a study that was done by Beth McGlynn. And what she did, it was really a fairly comprehensive study. They took about 7,000 patients, and they did something that always has me scratch my head. They went up to them and said, "Can we look at your medical records?" And they looked at about 6,000 medical records, and they compared them to guidelines on how care should be delivered. And basically what we found is that quality care was being delivered only about half of the time. You go in, you flip a coin, and you can determine whether or not you're giving quality of care.